Community Spotlight, powered by ATB Wealth Kelowna. Ready to take a powerful step towards the future you want today? Connect with local advisors at ATB Wealth Kelowna to get started.
Hello everyone and welcome to ATB Wealth Community Spotlight, where we do features on local people in our community that are making a difference. And today I'm joined by Sophia Capo, Dr. Sophia Capo. Thank you for joining me.
Yeah, thank you so much for having me today.
We were joking that you're like a regular in here anyways, but you and I have never chatted. It's the first time that we've been able to chat. So.
Super excited to meet you.
So maybe let's start, Sophia, tell us a little bit about what you do, type of patients you work with, a little bit of sort of the business as well.
Yeah.
Then we'll dig a little bit deeper into it.
Okay, sounds good. So I am an optometrist.
Okay.
So I did my undergraduate degree and then I did optometry school, and then I went on to complete an additional year called a residency. And this was specifically specializing in pediatrics and adults post-brain injury. So I practice optometry, but we specifically have a focus on kids and adults with brain injuries, adults with high needs, like diverse needs, and vision rehabilitation. So essentially, anyone who has had like a concussion or a motor vehicle accident or any like interesting symptoms that, you know, we can't quite figure out, those end up coming to me.
Interesting. So if we go back a little bit, like what got you into the profession? Like why did you decide to go down that path in the education? Like where
for optometry to begin with? Yeah. I actually was originally wanting to become a teacher.
Oh, okay.
And I was in the concurrent education program in sciences, my undergrad. And then I got my first migraine, and migraines sometimes come with something called a visual aura, which I'm sure a ton of people have experienced before. Which is like you get kind of like visual disturbances that kind of freak you out the first time it happens because you think that you're going crazy. And it was actually my optometrist who diagnosed me and was able to check my eyes, make sure my vision was okay, and then refer me to a neurologist so that I could get the appropriate treatment for my migraines. And it was, you know, meeting the optometrist to be like, wow, like this is actually really cool. Like this is a job that I could have. And then I kind of brought my love of education and teaching because now like I get to lecture in pediatrics and I get to lecture in the brain injury community. And it's so much fun because I've kind of integrated both of those things that I love together.
Interesting. So where did you go to school?
So I'm from Ontario.
Ontario, okay.
Yeah, my family is like just north of Toronto.
Okay.
And so I went to school at York University for my undergrad, and then the University of Waterloo for optometry school, and then I did my residency at the Michigan College of Optometry in the U.S.
So how did you make your trek across Canada?
Yeah, like why did I come here? Yeah, also a good question. Came here actually during COVID because life kind of threw a twist at me. I was supposed to be at a different location for like one of our rotations during school. And then obviously the borders closed and half the clinics couldn't take students anymore because they were closed. And so I ended up actually in Salmon Arm.
Oh, actually,
shout out to Shoe Shop Optometric. I love that. And like ended up there and then like basically discovered the Okanogans from someone, you know, from Toronto area. I'd never even heard of Salmon Arm. And then found out, you know, Kelowna is like such a good place. Like I visited here, I loved it here. I had a couple of friends who had ventured out, so it was like, this is a really good place.
Very cool. So when you came to Kelowna, were you working for somewhere else, or did you start your business right away?
I was working actually locally with the pediatric ophthalmologists. So the difference between ophthalmology and optometry, ophthalmologists go to medical school and they're eye surgeons. So they're kind of like the top of the totem pole. Think of an optometrist almost as like a family doctor for the eyes. And then when you need a surgery or if it's like something specialty care, then that goes to an ophthalmologist. So when I came here, I worked with the pediatric ophthalmologists and I kind of locumed at different places with the intention of opening my own clinic. So I'm the only provider who does like pediatric optometry and like evidence-based vision rehab in the interior. Actually, so it was kind of like like, wow, this is a beautiful place, and they don't have anybody like me. So it was really great.
Meant to be. So how long have you had the business then? How long have you been doing
So clinic's been open now for like, honestly, we're coming up on 2 years. Like
okay, cool. So and why, like, where did your passion, I guess, for working with children come from? Like, how did that come about in your journeys and what you're doing?
Kids are super fun to work with, first off, just because they will say anything. And you get to be so casual and fun when you're working with them. But also they tend to have vision issues that are harder to diagnose. and they're just a little bit, more finicky to work with.
Right.
So it takes different skills, different technology, and a different, mindset in order to create a management plan, not just with a kid, but with an entire family,
Right.
to then treat that child. And so I really enjoyed, just working with all the kiddos.
Interesting. So I'm curious, maybe it's your turn to lecture me or educate me. I'll say, how about educate me? Should kids be getting eye exams? All kids at a certain age, is that what you're okay?
So a lot of people don't know, but in the pediatrics world, we actually see kids for their first eye exam starting at 6 months.
Wow. Okay.
And that's because developmentally, sometimes kids when they're born, their eyes kind of move all over the place, and that's normal up until about 6 months. Okay. Which is why we let the visual system develop for the first 6 months on its own, because we're not really going to touch it, even if something's a little off. Yeah. And then after that, let's do an assessment and see what we can find. So anything that we find, not necessarily, a glasses prescription, but a health problem or an eye coordination problem. These things, if we can find them early, it is so much easier to treat, and the prognosis of the treatment is so much better. And so, a kid comes in and they're 6 months old, we can check their prescription. So I can know exactly what your child's glasses prescription would need to be, even though they don't know their letters, they don't know their numbers, they can't talk or anything. We can figure it out just by using a special light and tool to get that data. So from there, we can make decisions is this developmentally significant? Is this going to impact the way their brain and their eyes connect later in life? Right. And the earlier we can find those things, the better the treatment plan is moving forward. So, finding something at age 2 is way easier to treat than finding something at age 8.
Interesting. So when are you said 6, is that when you recommend you go for your first exam? Okay,
so 6 months is where we would say first exam is recommended. But let's say, you're out, you have a 2-year-old, you haven't been yet. Yeah. Anytime is fine. Anytime is fine, and you can come, and we'd be able to get all the information that we can get from an adult during an adult exam, we can get from a properly done pediatric exam.
Interesting. So how do you, I'm curious how you, because you have kids on one side and then the adult specialty service on the other side. Is that typical? I find
why are they connected?
They're so not connected in my mind, but
It sounds like they're not connected, but they're actually more connected than we think. So think of, for example, not necessarily, again, a glasses problem, not a health problem, but a coordination problem. Now, just because you have 2 eyes and they're healthy and they can see 20/20, for example, doesn't mean that those eyes work together. Now, think of that as just because we have 2 feet that are healthy doesn't mean we can dance. Dancing is a very coordinated thing to do. Okay. So our eyes need to coordinate and work together so that we don't see double, so we can see things in 3D, that kind of stuff. Now, eye coordination problems are very common in children, for example, who have developmental delays, learning disabilities, ADHD, autism, those types of things. But those same eye coordination problems tend to happen in adults after a stroke, after a concussion, after some sort of brain injury. So that's why the fields are kind of paired together. It's because the treatment and the diagnostics that you're doing for those patients are very similar, even though the ages are
very different. Interesting. Also notice in the website you have one of your pages is vision therapy. Yeah. So what is vision therapy?
What is vision therapy? Yeah. Vision therapy is essentially physiotherapy for the eyes. So let's say someone gets diagnosed with an eye coordination problem. Okay. Now, the most common eye coordination problem is called convergence insufficiency. So our eyes need to cross in order to look at something up close. Okay. That motion of eyes crossing is called convergence. Okay. So if someone has a convergence insufficiency, their eyes don't like to cross. Now, the gold standard treatment for that is actually exercises that teach the eyes to cross better. Yeah. So what vision therapy does is you come in once a week, and we give you exercises so that your eyes can learn to do what they can't do. So it's essentially like the dance lessons for our eye coordination.
Yeah, interesting. So is there, I think when I was in school, I remember way back when, years ago, they used to do eye exams in schools. Is that still a thing? Is that something how, I guess, how do we make sure, because, parents get busy, or they might think, well, there's nothing wrong with little Billy. He can see fine.
Yeah.
And they just don't come in. Like, how can we get that education out there other than do things like this to say, you know, it could be more too than just you think that.
For sure. And we see tons of those all the time. It's like, oh, my kid sees fine. We're just here for a routine check. And then you realize, you know, the kid has an eye turn, or the kid has a huge prescription and just didn't realize that they couldn't see.
Interesting.
But so there used to be a school vision program that unfortunately stopped during COVID. And actually recently, I applied for a grant through the Pacific Public Health Foundation with the support of Interior Health and with the BC Doctors of Optometry. And we piloted a project bringing optometrists into the school to actually do some exams on the kindergarten students. Because what we found was that, especially in the schools that need it the most, those kids weren't getting eye exams. And we don't have the full data set yet, like that'll be published. But we were predicting that about, you know, 10% of kids would be flagged as needing glasses or having an eye coordination problem, having a lazy eye or an eye turn or something. And it ended up being closer to 30% in our preliminary data. So, and a lot of the parents, the feedback we got was, you know, I didn't even know like that I could take my kid, or my kid doesn't know their letters. I didn't even think it could bring them. And so we're trying to bring these programs back into the schools. But it's hard because putting eye drops in kids' eyes is the only way that you can check glasses prescription accurately in kids. That's the gold standard. It's what we should be doing at every appointment. And you can't do it at school. So at schools, we could get, you know, a very good exam done, but we can't get the perfect exam done.
Got it.
And so, I mean, good is better than nothing.
Yeah, for sure.
But the goal is still to get people in office coming for their gold standard exam, because that's the way we're going to catch and make sure we're set up for success with everything else.
And the messaging is really to the parents, because a 6-month-old can't come in for an exam, you know, so it's the parents. And it's interesting because, you know, if I think of dental, like it's not always a great experience. You know, I think of the trauma I had when I was a kid going to the dentist, but eye exam, you know what I mean? It's fun. Safe, for lack of a better word. We call
it eye games. And like, that's all we do is we're playing, like there's matching games. We got the matching glasses games. Like everything is fun. We get to watch TV. The drops, sometimes they like tingle a little bit, so kids don't like it. But we describe it as like you go swimming, you get a little water in your eyes. It goes away after 2-3 seconds. And you're going to be okay for the rest of the time.
Yeah, you'll survive. Is there, you know, growing up, you hear all the myths, right? Like, don't stare at the TV too long because you're going to do this, or you're free video game all the time, and you have, or, you know, is that any of that based in reality, or is that, you know, is there studies to show that?
We know that there is an increased amount of screen time, just with a lot of people working remotely and like hybrid 100%. Work and like kids spending time on screens. We know that contributes to eye fatigue. So our focusing system when we're looking up close has to be on all day. We know that our eyes get more dry when we're looking at screens or computers for too long. And we know that in little kids, it actually tends to make their prescriptions higher. So it's nearsightedness can actually progress and get worse the more time we spend up close and the less time we spend outside. So one of those big messages for parents with kids, especially if the parents wear glasses. So like, let's try and spend as much time as we can outside. 2 hours a day is what's recommended by the optometric societies.
Interesting. And if you're working with children, if there's, and I know this is probably not one size fits all, but if there is something you need to correct, is it typically done through corrective lenses, or you know, it's not always like people are worried, I got to go into surgery with my child. Like, is a lot of it just being able to correct with the type of lenses?
We're trying to prevent surgery as much as possible, especially kids, because kids have to go under general anesthesia when they need surgery. So everything we're doing is trying to be proactive. So the earlier you get seen, the faster we can do something about it, the less likely your chance of needing surgery. So everything we're trying to do, and usually, like you said, it's through glasses of some sort or special lenses called prisms, or through some sort of rehab program like through vision therapy, is how we can perhaps get you to function well without needing any sort of surgery.
Interesting. You mentioned prism glasses, and I saw that. What are prism glasses?
What are prism glasses?
I hadn't heard that term.
You know, like
before.
the old, like, what is like the Pink Floyd album?
Yeah.
The prism and the light goes in and the rainbow comes out.
Right.
Essentially what prisms do is they move light around.
Okay.
So it's not like nearsightedness or farsightedness where, you can't see like far away, you
Yeah.
put glasses on, now you can see far away, right? That's nearsighted.
Got it.
Prism glasses help with eye coordination problems. So let's say I have an eye turn and, every so often my eye decides it wants to wander outward.
Right.
What prisms can do is prisms move the light so that your eye can still see even though it's kind of out here.
Right.
So it doesn't, it's kind of a Band-Aid solution.
Okay.
So we give it to someone so that because their eye's hanging out here,
Right.
like the prism moves the light to go where their eye is.
Interesting. Okay.
But it helps people, for example, eliminate double vision, keep their driver's license, and those types of things.
Okay. Interesting. I hadn't heard that term before, so I thought that was interesting. So I'm curious, what, like, where do you get your passion from? Like, what motivates you, like, from what you do? Because you sound like you're excited. You enjoy
I just
doing
really
this.
enjoy, like, everything I do is problem solving. So it's like no one comes in to see me with the same thing every day. It's like a different type of accident, a different form of rehab. And my job is to try and do everything I can to make them function better. Yeah. And it's really fun. And I mean, you try working with kids all day too is just like you feed off of their energy. Like they're laughing, like I get a little smile, like a gummy smile from a 6-month-old is like the happiest moment of my whole life.
But is it more, I mean, is there a part there where at the end of the day you're spent because you are dealing with kids or not? Like
sometimes, sometimes there's, but it depends. And from a provider standpoint, it's like there's always a kid who's having a harder time than you. Sure. Especially when you deal with a lot of the like diverse needs population, right? We welcome those people into the office and it's like, we have a chalk wall and we have blocks and we have like YouTube that we can watch on our exam screen because we want it to be a friendly environment for people to know that like you can come here, you're welcome, and we're going to treat you exactly the same as everyone else and we're going to have a good time, we're going to get the job done.
I need to come hang out there.
Yeah, come hang out.
Are you, so do you have capacity? I guess the big question is, do you have capacity to take on more patients? Are you looking to onboard more patients?
Yeah, we're actually looking right now at expanding to adult care as well. So I don't have as much of a passion for adult care as I do for pediatric care. Adults are cool. It's so funny. I have a funny rule that's like anyone who's under the age of 5 and over the age of 88 is automatically cute.
I love it.
And then everyone in between is a case by case.
That's funny.
But yeah, we have another doctor at the clinic who absolutely loves working with adults as well. And so yeah, we're welcoming like the entire family. So we could do everything from kids now to for our seniors.
Very cool.
And so we've invested in the equipment that's needed to look for things like early signs of macular degeneration, early signs of glaucoma, and those things which are required during, a routine adult assessment that's not required in a pediatric assessment. So we have all of the equipment now that we need to do the proper things for all ages.
Is there been a lot of advancement from an equipment perspective? I know you've run your business for a couple of years, but you've been practicing. Has there been a big change in sort of the tools you would
that are used?
Yeah.
Yeah, I think sometimes it's hard because we have some really great equipment that can be used to detect things early. And so that's really important because something like glaucoma, the faster we can find it, the better your prognosis is. That's kind of with everything. The faster you find it, the easier it is to manage.
Exactly, yeah.
And so we have like equipment that literally measures like the thickness of the nerve in your eye, which is the wire that takes the info from the eye to the brain. Like we can measure all of those things very accurately. And so those things are just getting better and better. We're getting better at getting the data. Yeah. But sometimes we think that those machines should be, like replacing certain other elements in our exams. And that's not necessarily true. So for example, with kids, the eye drops that I mentioned, we use those eye drops to check glasses prescription most accurately. It's not actually to check the health. In adults, we use drops to check the health. Right. So sometimes it's like, but we took a photo of the kid's eye, they don't need to be dilated. But that's not necessarily true. It's just the dilation's used for a different reason. So we have to be careful where we're using our machines to help us. Right. And make sure it's not replacing the need for, our manual techniques and looking at things when we have to. Outside of our machines.
I'm always fascinated because I always think back from like going kid to an eye doctor today, and some of the things, I'm like, well, the machine looks like the same one you used when I was 4. So I just wonder if it's advanced.
If it's advanced, yeah, the machines have gotten more accurate.
Yeah.
But I think it's the way that you gather the information from the machines
that's
and then
fair.
use it in your management plan.
That's fair.
For sure.
So now that we can take the whole family, so if people are interested and want to learn more or want to come see you or the other doctor, what should they do? What do you recommend they do? They pick up the phone, drop in, go to the website? Or all the above?
Any of those work. The easiest thing to do for people nowadays is probably just go online and you can book an appointment directly just from your phone or from your computer. So our clinic is called ABC, like SEE,
Love it.
ABC Optometry and Vision Therapy. We're located in the South Richter Professional Building, right across the street from Gyro Beach.
Nice.
And you can come anytime. We have appointments available and amazing staff and people waiting to meet you.
Awesome. So if you're interested, the website is abcse.ca.
Yes.
Super easy to get to. And there's a big book appointment button, which means you'll have. So
you can find it.
If you can find it. If not, just call, reach out if you have questions we might have not answered today about bringing their child in or whatever it may be. Just reach out. And I believe you're on social as well.
Yeah, you can follow us at Pediatric Optometry just for some extra health tips and fun tidbits.
Sophia's going to become an influencer, she said. So follow her social channels.
Yeah, do it. Help me become an influencer.
Well, Sophia, thank you for chatting today. I really enjoyed it. And hopefully people got some good education out of it. And we encourage you to just reach out and make sure you're bringing your child in for 6 months. At 6 months.
Or whenever. For the gold standard exam. We're happy to meet you and your family anytime.
Love it. Sophia, thank you for joining me.
Thank you so much.
Everyone else, thank you for joining us today, and we'll see you next week. And a big shout out again to ATB Wealth for sponsoring these segments. Thanks. Take care, everyone. Bye-bye.
Community Spotlight, powered by ATB Wealth Kelowna. Ready to take a powerful step towards the future you want today? Connect with local advisors at ATB Wealth Kelowna to get started.